Hello and welcome to Below the Belt. Welcome back if you are already a subscriber. I just had my pre-operative counselling session yesterday with the head urology nurse in Leeds at St James Hospital, the Paul Sykes department, and I want to share exactly how it went. This is important for anyone considering this procedure, so please stick around because these are things you need to know. This is part of my ongoing series documenting my full journey toward getting a penile implant, in the hope that it helps someone else out there going through the same. Please remember to hit the thumbs up, share and subscribe so I can continue to help and inform others. The nurse walked me through the entire process, what to expect before, during and after the surgery. She also made sure I understood something crucial. Once the implant is placed, there's no going back. If it were ever removed for any reason, I would no longer be able to have natural erections, or erections from pills, injections, or any other method. The surgery destroys the natural erectile mechanism, so the implant becomes your permanent solution, which is why informed consent and readiness are so important. The nurse was professional and highly knowledgeable, but also warm and down to earth. I felt genuinely listened to throughout. She was also refreshingly candid. She didn't beat around the bush, which I really appreciated. The consultation was long and thorough, which I didn't take for granted, especially knowing how stretched the NHS is right now. Time is precious in these appointments, and I can't stress this enough. Go in with a checklist. Jot down your questions and concerns beforehand, so you don't forget anything important when you're there. It can also be helpful to use ChatGPT to help you with this. So size concerns are a major talking point. I told the nurse I'm normally around 6 inches erect, and I was pretty anxious about losing size, which is a huge worry for many men. I've said this before in other videos. I don't consider myself big, and I don't consider myself small. I've never been particularly worried or interested in penile enlargement, but I don't really want to lose any size either. So the nurse stretched my flaccid penis and measured about 5.5 inches, which she said is likely what I'll end up with post-operatively. A natural erection, or one induced by PDE5 inhibitors like Cialis or Viagra, may appear slightly longer than the stretched flaccid length, largely due to additional engorgement of the glans or head. That's because engorgement of the penis is supplied by two distinct vascular pathways. The corpora cavernosa, the two erectile cylinders that run along the shaft, are responsible for most of the shaft rigidity and expansion. The corpus spongiosum, which surrounds the urethra and extends into the glans or head, fills with blood more modestly, but contributes to the fullness and appearance of the tip. After implant surgery, the glans is not mechanically inflated, so it may appear softer or less full, unless there's some residual natural blood flow. That's why, in some cases, PDE5 inhibitors may be used alongside the implant to enhance glans engorgement and reduce the appearance of a droopy glans, which is one of the symptoms results that some men are reporting after having a penile implant. She added that most guys she sees only stretch to around 4 inches, so I'm actually on the higher end, which was reassuring to hear. From what I understand, the average erect penis length is around 5 to 5.5 inches, but this figure likely drops in men who've had long-term erectile dysfunction, as some degree of atrophy or tissue loss is often involved. So, in that context, a stretched length of 5.5 inches is actually above average for implant candidates. Stretch length is a widely accepted method for estimating final post-operative implant length, and it's usually accurate to within half an inch. It may not exactly match the length of a fully engorged natural erection, but it provides a realistic guide to the expected surgical outcome. I appreciate that she didn't pull any punches when telling me this. It's important that men undergoing this procedure are aware of it and manage their expectations accordingly. At the end of the day, it's far better to lose half an inch and gain full, reliable function, especially when you consider that with an implant, you can get and maintain an erection whenever you want and for as long as you want, even after climax. It really is a case of counting your blessings. You may actually find you're better able to satisfy your partner than you ever were before, or than most men without a bionic penis could. Choosing the right implant. She agreed with me that the Coloplast Titan is the best option in my case, particularly because I have also developed Peyronies disease. The Titan is known for being more rigid, so it helps preserve length and straighten curvature. We briefly compared it to the main competitor, the AMS 700 Boston Scientific. That one offers a more natural feel, especially when deflated or flaccid, but it's less firm when fully inflated, which could be a disadvantage for men needing the extra support due to scarring or curvature. Ultimately, we were both in agreement. For men with Peyronies, the Titan is the stronger option. So what causes ED or Peyronies? I brought up my own case. I've had ED for about 10 years and it's only gotten worse. I asked whether it was even worth trying to figure out the underlying cause at this stage. A penile Doppler ultrasound is often referred to as the gold standard for diagnosing the cause of erectile dysfunction, whether it's arterial insufficiency, venous leak, or another vascular issue. But it's not routinely offered on the NHS, and the nurse confirmed that in most long-term cases like mine, it wouldn't change the treatment plan anyway. The nurse explained that in long-standing cases, the original cause often becomes irrelevant, especially when there's scarring, structural change, or Peyronies disease involved. She said, by this stage, whatever damage has occurred is likely irreversible, and knowing the root cause wouldn't really change the treatment approach. That was actually kind of a relief. I realised I could stop obsessing over the why and focus on what's next. I asked if the fact that injections still gave me a firm erection meant there might be still something to salvage. She explained that while that does show some vascular function was intact, the bigger issue is what followed. The injections were painful, and eventually they caused trauma to the tunica, which led to a significant bend, Peyronies disease. So even if the response was technically there, the treatment itself became unsustainable and damaging. At this stage, the underlying cause becomes less important because the tissue has changed, which again brings us back to the implant. the most reliable and definitive solution for both ED and Peyronies when other options have been exhausted or have caused further complications. The catheter fear. One of my biggest concerns was the catheter, because I've had one before after an opiate overdose. That experience was absolutely awful. I remember begging them to take it out. She thanked me for sharing that and told me it likely indicates bladder spasms or overactivity, which they can medicate for in advance. Medications like oxybutynin or sulfenacin are commonly used to prevent this. Just knowing they can manage that gives me more peace of mind. Post-operative pain. She was honest and said, yes, you will be in pain afterward. The scrotum will likely be swollen and sore, especially around the pump. But she reassured me that they'll put together a pain management plan, and most men get through it with support, rest, and a few weeks off work. I told her that I know Patrick Gordon is considered one of the top penile implant surgeons in the UK. He is my urologist and will be my implant surgeon. She confirmed that he has performed a very high volume of implant surgeries, which is crucial because surgeon experience is one of the strongest predictors of positive outcomes. So research your surgeon. Overall, I left the appointment feeling a lot more confident. Still nervous, but much more informed and very much like I'm in good hands, the best possible hands that I could be in, to be frank. I'll continue sharing every step of this journey. If you're in a similar situation, please know you are not alone. If there is anything I have forgot to mention, or if you have questions, drop them in the comments below, or feel free to share your experience. I genuinely love to hear it. So for now, so long from Below the Belt.